Brought to you by ExpressCare Health and Skin Center. Get in, get out, get better.
Welcome back. If you're just tuning in, we are talking about safe sex practices and other topics related to the issue. Joining me now to take some of our viewers' questions is ExpressCare's Dr. Jitka Lom. All right, Doc, now we've been talking about condoms, and you mentioned the female condom. Now our first viewer is asking, obviously, I know there are condoms for men. What are female condoms and are they effective?
They're just as effective as the male condom. They look a little funny because of course they're much bigger, but they come in a package. You can purchase them usually at a pharmacy or a supermarket, Kmart, and they're equally effective.
All right. Now our next viewer is asking, how do I know if a condom is safe to use?
Well, you would look at the expiration date for one. It does have an expiration date. If you store your condoms in your wallet or in your car or in somewhere where there's a lot of heat or sun or friction, the package could break and the condom could be destroyed. So it's important to keep it in a cool place that's safe. As far as any other things, you would just open the package and make sure that it was not damaged.
Not tampered with.
Not tampered, and you want to be careful ripping it open with your fingernails or your teeth so that it doesn't tear.
Yes. Okay, so our next viewer is asking, can you have an allergic reaction to the condom material?
Yeah, definitely. If you're latex allergic, you could, and that would be something to check out with your partner. Then you would develop itching and swelling of the genitals. It'd be very uncomfortable for you. And that's something that develops over time, because sometimes people aren't allergic at the beginning. They try things out for a year or two or as many, and then later on they develop a sensitivity to the chemical. So you'd become aware of that and you'd switch to a different brand.
Okay, so we're going to switch gears a little bit, and we're going to talk about the one topic that all parents dread having to do with their children. Our viewer is asking, how can I best support my child now that I know about his or her sexual orientation? And of course, how do I talk
about it? Yeah. So, you know, there, as you said, on Guam we have people that are straight, gay, bi, and anything else in between, and whether or not we agree with that, that's what they are. And I think, you know, it's on a spectrum, and when children start to experience their own sexuality, they're going to have questions, and they may have doubts, and they may also have there may be a time of experimentation because they're not sure where their orientation is headed. And this is really sensitive and difficult for parents, especially if they have strong feelings about, let's say, gay people or sexuality in general. So I think it's important to first be aware of what are your own beliefs, you know, so that you can be aware of that when you're talking to your kids, and then try to be take the conversation slowly and try to be supportive. The most important message you want to give your child is stay safe while you're figuring yourself out, and then I'm going to love you no matter what. And that's the most important message, because you don't want your child to be too afraid to talk to you. You don't want to ruin your relationship with your child over their sexuality. You want to support them and help them no matter what, even if you don't agree with the choices that they in the future may make. While they're a minor under your care, you have the right to decide with them, but later on they're going to make their own decision anyway. So you don't want to hurt them or have them experience, you know, distress when that's not necessary. Try to be as supportive as you can while setting limits, because that's what we have to do as parents.
Okay, now we're going to take a step back because our next viewer is asking, what is the morning after pill?
Okay.
Is it available on island?
Yes, it is. Morning after pill is basically a high dose of hormone that women can take after intercourse within the first 72 hours if they have forgotten to use a condom or if it broke, to prevent pregnancy. So remember, within 72 hours, that's 3 days after intercourse, you should take it as soon as possible is better, because then it works better. And it's called Plan B. It's available over the counter, or you can also get it as a prescription from your physician, and then it's covered by insurance.
Okay. Now going back to the talk, our next viewer is asking, I am a parent with an 18-year-old. How can I go about discussing with him safe sex practices?
Well, your 18-year-old probably already knows a lot more than you. But I think hopefully you would have started the conversation a little sooner. But at that point, at least you would talk to your child and explain that you respect them as a sexual person as well as everyone else's, and say that, ask them if they have any questions, if there's anything you can help them with. Probably they're going to be too ashamed and embarrassed. You can handle it by having some books around that might be helpful to answer questions for them. And just be honest about maybe your own feelings or things that you experienced in the past. Mainly, you don't really have to get into the nitty-gritty with them. Again, your role as a parent is to keep them safe and to make sure that they feel loved and supported.
Okay. Now, I had a question. You know, with today's, the TV in general,
Right.
there's a lot of sexual connotation.
Yes.
And even in cartoons, there's
Yes.
sexual connotation. So at what age should a parent, begin that discussion?
You know, kids ask questions at a really early age. Where do babies come from? You know, what's this body part for? They may ask you these questions. So right from the beginning, hopefully you're helping them start to understand the basics. But, definitely by the time your child is in middle school, they should have a pretty good idea about the birds and the bees and what goes on, and to be able to protect them from older people who may, be approaching them for things. So like, in middle school, some girls are already quite developed and they may be approached by older boys, and they should have an idea of what's going on.
I know, I've already, my girls, I have girls and boys, but my girls are 3 and 5, and I've already discussed the whole
Yes.
private parts.
Private parts, who's allowed to touch your private parts, all of that.
Yeah.
And then, helping people understand about women, girls about their periods, boys about, nocturnal emissions and wet dreams and all that. These are important things to talk about with your kids, and be sure that they feel comfortable to come and ask you questions. And if you feel like you just can't possibly do it, you're just too embarrassed, find a family member. Maybe there's a, aunt or grandma or somebody who can talk it over with them.
All right, Doc, thank you so much
You're
for your
welcome.
expertise. All right, well, we all know that this can be a very uncomfortable subject.